As women age, their chance of becoming pregnant decreases. However, new medical procedures are helping older women get pregnant. As we hear from Dr. Hal Danzer of the Southern California Reproductive Center in Beverly Hills.
If you're concerned about fertility, many women come for a consultation, and we work with the gynecologist in outlining a treatment plan. The one thing that you don't want to do is spend 2 to 3 years doing treatments or not doing treatments and then be 40 years of age when you start with a fertility specialist. I think that's not what you want to do. The majority of patients are late 30s, early 40s, and some in the mid-40s. Many of them are professional women who have had a career and have married late or decided to start their family in their late 30s or 40s and are having difficulty. There are ways that you can begin to assess your fertility. A day 3 FSH is a simple blood test looking at follicle-stimulating hormone, which would give a woman an idea about her follicle or egg reserve, what her potential fertility might be in the future. Any gynecologist can perform that test, or family physician. If for some reason it would indicate that the woman is beginning to diminish her egg supply, at least then she could look at her options of perhaps being a single parent and using donor sperm if she was not in a relationship at that time. So at least at that point she wouldn't lose her chance to have her own genetic child. The testing for fertility today is really pretty simple. It's about 3 tests. Obviously in a relationship, the man would have a sperm count. And if the sperm count is normal, the man is sort of ruled out and you focus on the woman. One of the first tests you do for a woman is to evaluate her anatomy, the uterus and the tubes, and that's done with an X-ray called a hysterosalpingogram. It's relatively easy to do. Then the next area to really be concerned about is the woman's ovulation and her follicle or egg reserve. And that's done again with ultrasound and blood tests, very simple testing. So with those 3 tests, the woman can have a good sense of what her potential fertility is. There's some very new data to show that the woman's age is probably more important even than the blood test. And that's why we tend to recommend aggressive treatment even in the late 30s for women if they're having difficulties getting pregnant. There's a tremendous amount of research focusing on how to reverse this age effect on the ovary. And we know that the age effect is on the chromosome of the egg. Structurally, the egg is really pretty intact. When we do IVF, we can generate really nice quality, structurally great-looking embryos, but it's the genetic material of the egg which has the age effect. And the geneticists simply describe it as the chromosomes get sticky. And right as the woman begins to ovulate, she has to unravel her double-stranded DNA. And if you had sticky chromosomes, DNA gets left behind or broken off. So that when this egg gets fertilized with the other half of the DNA from the sperm, you have an unbalanced genetic pairing. And again, an embryo that's unbalanced may last 3 or 5 days, but is not going to produce a pregnancy. Of course, the incidence of Down syndrome and other genetic mismatches rise the rates of miscarriage and Down syndrome. So the research today is to look at some way of reversing this sticky chromosome issue. One of the most rewarding times in our practice is when they bring the new baby. It's 2 weeks, 6 weeks, 6 months, and to be able to see a new life and a family that's started, and the happiness that's brought to couples, families that really didn't have that before. I don't think there's any reward in medicine as great as that.